just a little background. I was talking to Steve earlier. I mean, we always see with Nu Skin, I have to sometimes remind myself that this is not typically how a lot of companies approach research work. They often rely on ingredient data or existing research that's out there, which is fantastic. I mean, in the scientific community, we all know that we rely upon all of the work of others that precede us to understand more as we develop products and devices and whatever field we're in. But what sets Nu Skin apart that I've seen just over the years is that we have a really deep commitment to ensure that all the products that we put out there, all the devices are backed by our own research. So if you have the chance to ever travel to Provo and see our headquarters, you'll see we have an entire floor of our innovation center that's dedicated to just clinical testing. So my lab is on that side of the building. We do, of course, we do in vitro work, we do ex vivo, we do actually in vitro, we do all of it. So we do all of this on all of our products. And I mentioned that because that same approach is how we developed PRISM. So as we look through the studies together tonight, I just wanted to emphasize that because all of the clinicals that we have either published or about ready to publish, they're actually sitting on the shoulders of just literally like 100 tests that we've been doing just on this device. So without further ado, I thought I would set up just the whole clinical program, go over the different studies that support it. We will review the results out of Stanford Medicine. And then if there are any questions at the end, I'm happy to answer those. So let me go to the next, if I can figure out how to use my Google thing here. How do we advance?
Melanie, I think you just advance with your computer or with your keyboard like you would.
Yeah, it's not letting me do it.
Yeah, if you actually open your presentation, not on the screen of your presentation, you click on it.
How is this? Can we see that now?
Yes.
Oh, perfect. Okay, sorry about that. Okay, so this is a snapshot. I really love this slide because it really gives a good overview of our entire clinical approach with PRISM. So if we start in let's start in the upper right area. We have 80 plus studies that have been done on hyperspectral measurement technology, which is the technological backbone behind PRISM. So hyperspectral, of course, we know it just means many different lights. We have different LEDs in PRISM that are firing just over 700,000 measurements within those 15 seconds that it's taking your PRISM score. And within that, we are getting loads of data that we eventually will derive your score from. So we have 80 plus studies, and I'll mention all of these, but also important to note that all of these are available. We have them linked. I think I can share the link with you when we're done, but we have them linked on our Substack, so you can download, share via social media, however you'd like, read about them in greater detail. And then we have 3 studies that have already been published. So those are there on the left there, and we'll go through all of these in great detail. And then on the bottom, what we took was a multi-pronged approach to how we looked at this. We wanted to make sure that we were validating our PRISM score to a known gold standard biomarker, which is serum carotenoids in the blood. So we have that clinical. We also wanted to look at how do lifestyle, diet, other factors relate to PRISM score. So we did a very large scale study at Jiao Tong University in Shanghai last year, and that has 2 phases, which we'll go over. And then we did a study on LifePak. This was your gold standard design, double-blind, placebo-controlled clinical trial done with Dr. Hanjo Kim of Yonsei University in Korea. And then last but not least, recently finished our work with Dr. Ann Chang of Stanford Medicine, which will share those results. So really exciting because your group, Steve, is the first group that I have shared these results with. So very excited to go over that with everyone tonight. Okay, so the first one, this is our serum carotenoid validation study. We did this with Dr. Zoe Drelos, and some of you may know Dr. Drelos does sit on our scientific advisory board. I've known her my entire career at Nu Skin. She's a fantastic resource, known as the rock star of dermatology. She travels the world to give lectures. She also is an adjunct professor at Duke University, and we have the honor of having her on our board. We went to her to do this work because we wanted to look at how does PRISM, the score, relate to a known biomarker in the blood? So, of course, serum carotenoids would be considered the gold standard to do this correlation. The tricky part with looking at serum carotenoids, though, is that this is not a commonly available assay. So you have to go to a specialized lab, at least in the US, to get this done. So we have to draw the blood, we freeze it in a -80, and then it gets shipped to the lab that will do analysis, and then you get the readout. And that entire process it's about a 21-day turnaround time. So imagine having PRISM now. We've got a device within 15 seconds. You're going to get your PRISM score, which is correlated very strongly with serum carotenoid levels, and you don't have to go and get the blood draw. So we're not trying to suggest that this replaces a blood draw, but rather to just emphasize how big of a scientific breakthrough this is to see that you have a non-invasive way to measure a known biomarker that tells you about your nutritional wellness. So we have, I just put on here just our correlation graph. This is published. So this is one of the studies that are of the 3 that are currently published, and we've linked up so that you can access and read in greater detail. So the next one is, let's talk about the Jiao Tong University study. This was done with Dr. Meikin Kai, and she did a 2-phase approach. So the first phase was we had almost 600 people in this clinical, which is one of the largest studies I think we've ever done at Nu Skin. And the point of the study was to look at what are the different lifestyle factors, anything from diet, sun exposure, activity level, BMI, things in the environment that would influence or be associated with a higher or a low PRISM score. So I think it's interesting for this because we know intuitively that higher BMI is associated with maybe, factors that might be not as healthy of a lifestyle. We've seen it in the past with lower biophotonic scanner scores. Same thing with a UV exposure. So being out in the sun, generates a lot of free radical damage. There are things that we know in our diet that might increase or not increase the score. But to actually have all of the data and to be able to show association is what's so powerful about this clinical. So on the right, we've listed all the things that correlate with PRISM, with your score, things that impact it. So some of the things that I just mentioned, UV exposure, diet, like what you eat matters, physical activity, gut health, immune health, vitality, skin, and sleep. So what we saw was that diet quality, unsurprisingly, is a very, very strong predictor of your PRISM score. So in this clinical, we had 589 subjects, a broad age range, broad scoring, so we could see these associations. So the participants that had a diet rich in whole grains, fruits, like dark colored leafy greens, fish, nuts, eggs, those types of foods strongly predicted a high PRISM score. Conversely, things like frequent consumption of red meat, fried foods, a lot of alcoholic drinks, maybe flour-based foods, sugary foods and treats correlated with a low PRISM score. We also saw, and these are all significant, statistically significant, that UV exposure is associated with a low PRISM score. And I think this is one of the most, in terms of like holistic approach to wellness, a key part of it, because we hear that, well, you always need to wear SPF, Well, this is why. I mean, it generates a lot of free radical damage on the skin. Wearing SPF is critical. Those that are going out without sun protection, it is directly related to lower PRISM score. Similarly with sleep habits, those that were getting, good regular sleep, 7-8 hours a night, correlated with higher PRISM score versus those that had irregular sleep pattern, maybe staying up really late, getting poor sleep, had a lower score. And then the next one, of course, with physical activity, and I think I mentioned this with, higher BMI associated with a lower score. If you are more active, getting regular activity and exercise, then that is correlated with a high PRISM score. And all of this to say that it just paints a whole picture of why all of the things we do in our daily lives are so critical to supporting our overall well-being, and why we talk about our PRISM score as a marker of nutritional wellness. So it's what you eat, what your habits are, your lifestyle factors, things in your environment, if you're going outside a lot, are you protecting your skin? All of those things matter. What we do matter and adds up day over day. So this study really underscores all of the different habits that we can take action on to improve our daily lives. It's also reflected in our score. Okay, so the next clinical, we finished this early this year. We have not yet published this, but we're in the process. But what we're doing here is we did a double-blind placebo-controlled study. This was done with Dr. Hanjo Kim of Yonsei University in Korea. We had participants they consumed, we had an active group that took LifePak, and then, of course, our placebo group. And what we saw over the course of 8 weeks, and we have this there on the graph, that we had statistically significant improvement in score with the active group. So we anticipate this, but to have the actual data here, it just shows, okay, we've got our lifestyle factors that we've demonstrated via our clinical, that there are different attributes, different things we do in our lives that impact that score. Now we have the clinical data that shows, well, what can you do about that? Well, you can take a supplement like LifePak that not only has those antioxidants, those carotenoids that support your PRISM score, but also fill in your nutritional gaps. Because most people, I know I struggle to eat all the right foods every day, and that's why I take my supplements, is to meet those gaps. So we have the clinical that supports that as well. What I really loved out of this study is, as part of the design, we of course did our PRISM. We also looked at skin, because what you eat is reflects on your skin. So what we saw here is, if you look at after 8 weeks, so that's the dark blue bars, you can see, like, across the board, the group that took LifePak had significant improvement in these various skin features. We also did a measurement with a spectrophotometer on the face to look at changes in skin brightness over the course of the 8 weeks, and saw significant improvement after 4 weeks of LifePak supplementation. And so I think this is just so powerful, because there are no topicals involved in this study. This is just purely from taking LifePak, supplementing with that once a day. And you can see the impact. You have the internal impact. You can see that with the PRISM score, but you also have a visible improvement in your facial appearance. So it ties in, like, the beauty and wellness integration approach, which Nu Skin is all about. And you have all of that measurable in 15 seconds. So really exciting results that we got out of the Yonsei work. And now we'll talk about the results from Stanford. So we did a clinical with Dr. Ann Chang of Stanford Medicine. She is a professor with the Department of Dermatology there at Stanford. And what we wanted to look at this was, what are the different, similar to the Jiao Tong work, what are different drivers that would suggest you're like a high versus a low score? But also, what are the different skin features that we might pick up with a high score versus low? And then we, for the first time, included epigenetic testing with all participants in this study. So the data that I have to share with you tonight, we will focus on the epigenetic piece. We don't have the full write-up of the study yet. It literally just finished less than a month ago. And so we are combing through all of the data. There is a lot more to come from this, but the epigenetic results are so exciting. We wanted to make sure we at least give you a top line view of what that's looking like. Just to share a little bit about the study design, we have 33 subjects that we've analyzed thus far. There's 36 total. A pretty good split between male and female. And then we did a bimodal design per recommendation from Dr. Chang, and looking at, well, we want to see what the differences are, not only in epigenetic biomarkers, but also in facial appearance, and are there any differences in lifestyle and diet patterns when we look at two distinct age groups. So we had a younger group, which we recruited from age 21 to 40, and then an older group from ages 60 plus. We had really good distribution of score range, so you can see there anywhere from the low of 100 up to 920. The different measurements included, of course, we did PRISM measurement, we did epigenetic testing, which we'll go over those results here tonight. And then we had some questionnaires and imaging, which Dr. Chang graded. We are waiting for all of the items that aren't bolded, so those three. So we'll have to come back and update with how those turned out, because we'll be doing a lot of correlative work between those different factors and PRISM score, along with the epigenetic side. So, of course, just as a review, we're familiar with epigenetic testing, but what's so great about this is these are factors that you can actually take action on. So you'll get your reading and you'll be able to make some decisions like, well, maybe I should be taking a supplement that might address some of the things that were flagged out of that report, or there's different lifestyle factors that could be adjusted based off of that. The compelling part for us to include this is that it will give you your biological age. So that was so important because we're closing the loop on this whole process where we are looking at lifestyle factors. We validated versus a known gold standard biomarker, which is serum carotenoids. We've supported with a double-blind placebo-controlled trial with LifePak, showing that you can significantly improve your score and other factors like skin benefits with LifePak supplementation. And now we have this final piece that's like, well, what is this doing for you like internally? What does this all really mean? And we're going to see here in a moment how the PRISM score is associated with biological age. So first is interestingly, we saw that those that have a higher PRISM score had a younger looking immune profile when we looked across the different markers from the epigenetic work. They had lower CRP, fewer neutrophils, more monocytes, more memory T cells. So just showing like and this was adjusted for age. So we can see that those that had a lower score had maybe not as great of an immune profile as those that had a higher score. So this is really powerful because normally we wouldn't get all of this information unless you were going to go and draw blood and actually analyze for all of these. Here's the next. So with part of this, we were looking at the score against different age clocks. So this data right here specifically is with the Symphony age, which is a published clock that was worked on, I believe, in collaboration with Harvard. So this is an age clock that many other studies will reference. There are a few different ones that we looked at, But in particular, the Symphony age will break out against 11 different organ systems and show you what's your biological age looking like for these different organ systems. And then it'll give you a composite biological age score as well. And so what we saw here is across the board that these all trended lower with those that had a higher PRISM score, which is so incredibly exciting that when we saw this, we thought this explains everything. So you don't always, maybe you won't feel the impact of LifePak in the same way that you would feel the impact of maybe putting on a skincare routine, but it absolutely makes a difference what you put in your body, taking a quality supplement, eating healthy, good variety of foods, adopting healthy habits. Those are all things that impact your biological age, as we can see here with the data. And then I think the last is just a quick summary of when we look across these 11 organ systems combined, we have about a 4.3 years younger biological aging with those that have a higher PRISM score. And we saw this across all of the 11 organ systems, which we just reviewed in the previous slide. So really exciting. I mean, there's a lot more to come from this for sure. Steve asked me to maybe give a little teaser of what other things we might be doing. We're always doing more research at Nu Skin. So even though we finished our last big clinical to launch PRISM, that doesn't mean we aren't still doing more studies with PRISM. So we have more studies underway. We have one in the UK that is wrapping up. So I'm excited to come back and hopefully share those findings here. Probably in about like a month and a half, we'll be able to share some data out of that clinical